Hello, my name is Natasha Sabadash, and I am a dental hygiene student in Algonquin College. I'm here today to discuss the effects of the oral cavity and diabetes. Diabetes significantly decreases or stops production of insulin, which is a hormone needed for controlling the body's blood glucose levels. When there is no insulin to metabolize glucose, the body will not have the energy it needs to function properly, and glucose levels will remain too high. Although glucose is necessary to create usable energy, diabetics typically have too much glucose in the bloodstream. Elevated blood sugar levels in uncontrolled diabetes leads to the increased levels of bacteria. It is also harder for diabetics to fight bacteria due to their suppressed immune system. The immunocompromisation is a result of blood sugar levels that stay elevated for long periods of time, which impairs the function of white blood cells. White blood cells are central to the role of the immune system, and when these cells are unable to function properly, the body is less able to fight bacteria. This means that the inability to fight bacteria, along with the increased levels of bacteria in the mouth, can quickly get out of hand and contribute to periodontal diseases. Diabetics are also more prone to having a condition called xerostomia or dry mouth. Xerostomia occurs when the production of saliva in the oral cavity is reduced or limited. The lack of saliva means that there is a reduced ability to wash away debris, such as food particles and bacteria in the mouth. Dry mouth also leads to more periodontal complications like soreness, ulcers, infections, tooth decay, and thrush or candidiasis. And without saliva to keep your mouth moist and bathe your teeth, you would be at risk of these conditions. Dry mouth is a complication of diabetes that can cause periodontal disease because of the additional bacteria adhering to the teeth structures. This is more common in uncontrolled diabetes since high blood glucose levels result in increased bacteria. Periodontal disease, like gingivitis and periodontitis, are in a direct relationship with diabetes. This means that diabetes can contribute to periodontal disease, and periodontal disease can influence the sugar abilities of the body in a diabetic. It also has an effect on the inflammation. So gingivitis is essentially the inflammation of the gums or gingiva, and it usually occurs when the bacteria adheres to the teeth. Periodontitis is a serious gum infection that damages soft and hard tissues of the supporting structures around the teeth. As we have seen previously, high glucose levels in people with uncontrolled diabetes causes an increase in bacteria, and when combined with this suppressed immune system and xerostomia, it makes sense that people with uncontrolled diabetes have inflammation of the oral tissue.
Overall, the lack of insulin production, increased blood glucose levels, and increased bacteria in the oral cavities contributes to poor oral health in people with uncontrolled diabetes mellitus. These factors are strongly correlated with a suppressed immune system, increased xerostomia, and other issues, which lead to periodontal disease in the long run. It is true that gingivitis and periodontitis are more prevalent in people with diabetes, and it is important to remember that these conditions are controllable with regular oral care such as brushing, flossing, and regular visits to the dental office. It is the responsibility of the healthcare worker to understand the relationship between uncontrolled diabetes and its effect on poor oral health. So with education and sharing of knowledge on the subject, it should be possible to reduce the occurrence of serious periodontal disease in diabetics, leading to a better overall health and well-being.